Hello, everybody, and welcome to the second of our two webinars on Healing Arts Birmingham. In this webinar, we're going to cover what Healing Arts Birmingham is, how you can get involved, and our Healing Arts Birmingham grant programme. Just a bit of housekeeping before we start. Cameras and mics are turned off for this webinar, but we'll be able to unmute anyone that wants to speak during our Q&A section that will be at the end. The webinar is going to be recorded and the recording will be shared after with everybody. If you have any questions, please do add them into the Q&A section that's at the top of the screen on the taskbar. Or if you're having any trouble with that, you can add them into the chat as well. We'll have plenty of time at the end to discuss that. So the agenda for today, we'll talk about we'll first start with Sally Burns, our Director of Public Health. We'll talk about the Birmingham Public Health context. Then I'll give a bit of an overview of the Birmingham Creative Health Programme. Then we'll hand over to Catherine from Jameel Arts and Health Lab, who will talk about the approach taken in Healing Arts. Then I'll give an overview of Healing Arts Birmingham Festival, how you can get involved, and our small grants programme. And then we'll have time for a Q&A. So to start us off, I'm pleased to introduce Sally Burns, our Director of Public Health at Birmingham City Council, who will set the scene by talking about Birmingham's public health context and why creative health matters for the city.
Thanks, Alex. So, morning, everyone. I hope you can hear me okay. I'm Sally. As Alex says, I'm the GPH for Birmingham. It's fantastic, first of all, to see so many people on the call. Thank you for your interest in this programme. It's really appreciated, and to know that you've got, a shared passion for how arts and culture can play a role in improving health and well-being. So welcome, and hope you find this really helpful, and we're really looking forward to, applications from you and working with your organisations going forward. So just a few things from me. So obviously, I know a lot of you know this already, but basically, Birmingham is one of the sort of youngest and most diverse cities in Europe. And our diversity is one of our greatest strengths, first of all. We're a city rich in creativity, rich in culture, and really rich in community life. So, it's a really exciting moment, really, making the link here. Also, we know that we've got some really huge challenges as far as inequalities in our city, across our communities. And it's just not right that, where you live, your background, your life, your circumstances have a really powerful influence on your health outcomes. So, we're really committed as a city to really working on this harder. We're trying to increasingly focus on prevention, on neighbourhood-led approaches, and on a sort of health in all policies perspective. So that fits with, the sort of movement in the health system at the moment, but also in Birmingham, we're really committed to working in this way. And you'll know, we've worked with a lot of organisations on the call already on this. We are really committed to investing in communities and working together to see how we can really change some of those challenges. And this is where creative health is important, really. So creative health recognises that arts and culture and creativity are not simply just nice to have. They're really keen to how our communities experience well-being, how they experience connection in their communities and purpose in life as well, really. And, we know that if people connected to their communities, it has a profound impact on well-being and also on behaviours and on long-term conditions and things like that. So we're really keen to, work in this way and support this. Also, creative approaches often reach people who are least well served by traditional systems. So they really help us to do that and make links. So obviously that's another reason for us in public health wanting to support this. In Birmingham, the arts and culture sector is a huge, important part of our identity and our economy and our community well-being as well. It reflects who we are as a city. It reflects that sort of neighbourhood and civic pride as well. So we think we're building from strengths really on this agenda. So the Healing Arts Birmingham Festival is a really powerful opportunity within all that context. So over the course of the week, and Alex will be talking more about this shortly, the festival will showcase a wide range of incredible creative health activities taking place across our city, and that's what we want to achieve. So it will be led by, some of the big organisations in the city, but we really want to reflect sort of community stories, cultural organisations, and see public health and health partners and communities all working really closely together. And it helps us to sell a really sort of powerful and ambitious story about how this will work in Birmingham. So there's three things that I really wanted to get over. So from a public health perspective, it will really help. This really matters for three reasons. So first of all, it helps us to build that shared understanding of the common language between arts, health, voluntary and community sectors and why this matters. So I've already talked a little bit about that. Secondly, it'll help us to build relationships and momentum. And the change we're looking for in the city won't just come from this 1 week alone. We're wanting to follow this through, learn more about connecting, learning from each other from different cultures and different communities, and also to really sort of reimagine what collaboration can actually look like. And then thirdly, it helps us look forward, as I say. So Birmingham is definitely on a trajectory to become a national leader in creative health. And Healing Arts Birmingham in June is a really important step on that journey, and we really sort of value it. I hope the webinar today really helps. I hope it helps people think really creatively around this and brings out opportunities to work across sectors and things like that. I'm really excited about the week. I'm really excited about the opportunity, but I'm also excited about how we move forward on this agenda as well. So thank you very much for attending. Obviously, as Alex said, there'll be lots of time to ask questions at the end of this. I hope you enjoy and really look forward to working with you all in the future. Thank you, Alex.
That's a really useful overview of why creative health matters for Birmingham and why Healing Arts Birmingham is going to be so important for the city. I want to spend the next few minutes talking about the core aims of the creative health programme, how we're taking that forward in practice and how Healing Arts fits into that journey. So in terms of the programme aims, one of the most important shifts for Birmingham Creative Health has been moving away from seeing creative health as a series of standalone projects and instead focusing more on building the conditions that allow creative health to thrive as part of a system. The Creative Health Programme is really about moving beyond Birmingham City Council's role as a commissioning body towards actually building that infrastructure capacity. So in terms of the core aims, firstly, we're looking at strengthening partnerships. That's really about bringing together arts organisations, health partners and communities in more intentional and joined up ways so that creative health activities better integrated and more sustainable across sectors. Secondly, we're also looking to build on quality, learning and evidence, and that means supporting artists and organisations to work confidently and safely in health context and strengthening how we understand and demonstrate impact, not just so we're evidencing the value, but also that we're informing better practice going forwards. And finally, it's about ensuring that creative health reaches communities that are most affected by health inequalities. So that means being really mindful of access and representation and place, and supporting work that's both culturally relevant, but also situated locally across Birmingham. In terms of some of the key ways that we've done that and how we've embedded that in practice, that includes embedding public health research officer roles within arts organisations, investing in training and supervision for practitioners, and developing ways of working that allow learning from individual projects to really feed back into the wider system. I'm not going to go into lots of detail about our specific projects on our programs, but I'm happy to answer any questions about that in the webinar. But really, all of this is about moving beyond kind of isolated creative health activity towards a more coherent, confident creative health ecosystem in Birmingham. And that's where Healing Arts Birmingham comes in. So Healing Arts for us isn't just a 5-day festival. It's a way of bringing together the work and the people and the conversations that are already happening across Birmingham in terms of creative health, and using that to build momentum for creative health in the city. The festival is going to allow us to showcase the breadth and the impact of creative health activity through things like performances and exhibitions and participatory work that we really want to be representative of and accessible to the diverse communities in Birmingham. And it's about making all of that work visible and tangible and valued. It's also an important opportunity to connect people who don't always sit in the same spaces. So bringing together artists, community organisations, health and social care professionals, policymakers and academics, and using that to create opportunities for learning and collaboration across the sector. Alongside the public-facing activity, Healing Arts should also give us a space to share evidence and learning, and to demonstrate how creative health contributes to public health outcomes in real practical ways, because I think so often creative health is seen as something that's like a nice to have or something that's on the side of real public health, and we want to show that that's not the case. And finally, it helps us to look forward. So through conversations, workshops, shared experiences, we want to use Healing Arts to help shape the next phase of creative health in Birmingham, really ground it in practice and make it informed by the people that are doing the work on the ground. Ultimately, what makes Healing Arts important isn't just what happens during the festival week, it's how we work together before and after it. And that's how Healing Arts is going to support the long-term change for creative health rather than just being a standalone moment. Before I go on to discuss the details of Healing Arts Birmingham and what's happening and our grants programme, I'll hand over to Jameel Arts and Health Lab to Catherine, who are our main delivery partner on Healing Arts Birmingham, to briefly explain the Healing Arts model. Catherine?
Thanks, Alex. Hi, everyone. I'm really excited to be here today and delighted that there's so many of you on this call, the second call of the week. So my name is Catherine Cassidy-Dedix, and I'm the Global Director of Healing Arts for the Jameel Arts and Health Lab. Could we have the next slide, please? I'm also delighted to say that I did start my arts and health career in Birmingham about 25 years ago, in dance and a young adolescent psychiatric unit. So that was a kind of start point for me. The Jameel Arts and Health Lab is made up of 4 founding organisations. So the WHO Europe, you can see the quote here from Dr. Tedros. NYU, New York University, led by Professor Nisha Sajnani, who oversees the research, global research, and over 74 research affiliate programs happening all over the world. Neil's at the WHO, who oversees the policy aspect of our work. And then Culture Runners, based in the UK, which is the organisation that I work for, and we oversee pulling together all the events, including all the healing arts activations and festivals, and also the publications of policy documents in partnership with the WHO. So really, we're all working very hard together to raise the awareness of the impact of arts and health and measurably improve lives in that way. Could I have the next slide, please? Thank you, Alex. So this just shows you a little bit of our model and our approach. So you can see there research, policy and outreach. And capacity building is something we've been working quite hard over the last couple of years. So looking at delivering training and what is arts and health, training and how to research and evaluate arts and health outcomes, and how to build successful partnerships and networks. So you'll see there that one of our focus is to work with underserved communities, as I'm sure that's the focus of all of you on this call. And in the recent year, we've been working to deliver healing arts activations in several cities across America, also in Singapore, in Barcelona, other European cities. And in the next coming years, we're really very much focusing on the Global South. So this year, we're proud to be working with Healing Arts Birmingham, Healing Arts Scotland, which is the first and only still national healing arts event. And I led the delivery of that 2 years ago. There's another one happening the week immediately before Healing Arts Birmingham, so please do come and attend. We'll have guests from all over the world speaking, and the national event days are on June the 18th and the 19th. And working very closely with Scotland's Chief Medical Officer and Minister for Culture to see some policy impact happening there. This year we also have Healing Arts in Lviv and also in the United Nations General Assembly Week in New York in September, which is an annual Healing Arts Week as well. So you'll see here some examples of the kind of research we undertake and those policy recommendation documents at the bottom of the slide. Next slide, please, Alex. And the outreach. So you'll know, and you'll have seen at the start of these slides, hopefully, that very stunning image created by a local artist of Aussie the Bull, which is the flagship image for Healing Arts Birmingham. And we'll work closely together with all of the kind of grassroots and senior arts and health organisations across Birmingham to really kind of galvanise the movement, as Sally said, and leverage the impact over the week. And next slide, please. And just some examples of it, the different ways that we work in policy. So there will be roundtable discussions happening, closed door discussions happening during the Healing Arts Birmingham week, in the same way that we do deliver those across other cities. We'll invite those from the WHO and others from across the UK and Europe to support those discussions with learning and insight into what's happening around the world. To build momentum. But we also do publish policies, and you'll see there the Art for Climate, Health and Wellbeing policy document, which is the third on the bottom of that slide, and that's being launched just next week on the 28th of April. And that's all from me. I'm around for questions if anyone has any questions. And yeah, the last slide just to cover capacity. Back to you, Alex.
Thanks, Catherine. That was really useful explanation of the kind of background to healing arts, the different healing arts festivals, and the general approach that Jameel Arts and Health take in running healing arts. I'm now going to go into some detail on discussing what Healing Arts Birmingham is, how you can get involved. So this slide should give a bit of a snapshot of what Healing Arts Birmingham looks like in practice. It's a week-long citywide programme taking place 22nd to the 26th of June. And it's all about bringing together cultural activity, community-led work, creating spaces for learning, but also things like research and policy conversations as well. It's important to note that it's not just one central event. It's going to be lots of different activities happening across neighbourhoods, different venues and organisations, and led by lots of different arts and health partners across the city. These are the core themes guiding Healing Arts Birmingham. They should be reflective of the range of different creative health practice that happens across the city, from place-based community work, work in clinical and social care settings, but also things like evidence and policy involved in creative health. They're intentionally broad so that organisations and practitioners working in quite different ways in creative health can hopefully see themselves reflected. I won't go into detail explaining all of them now, but I'm happy to talk more about them during the Q&A. And just to remind anybody that's only just joining, there is a Q&A feature in this webinar, so you can either add your questions in the Q&A or within the chat as well. And then we'll have about half an hour at the end to discuss that. In terms of the delivery approach, we're thinking about the programme across three broad strands. So some activity is focused on policy, research and system leadership. Some is community-led, participatory, neighbourhood-based, and some is more focused around practitioners, so artists, health professionals, and others learning from each other and discussing the practice that they have around creative health. And we want that to be reflected in both the audience, but also the different types of activities that take place during the week. So here's some of the examples of activity that are happening during the week, and you can find out a lot more information about this on the Healing Arts Birmingham website. If someone could put that link in the chat, please. It's important to say this is a selection of examples that should show a bit of the range and the scale of the week, but it's by no means the full or the final programme. We're still developing it at the moment. The programme's still being developed, and more details can be found on the Healing Arts Birmingham website, as I said. Across the week, activity is going to include things like conferences and research symposiums, alongside kind of research panel discussions, but also more of your kind of community focused events. So public wellbeing events, cultural activity delivered by organisations across the city. I should say that at the moment, a lot of the activity that's taken shape is conference and research focused, which reflects kind of how the programme has developed so far and should bring that kind of credibility and academic rigor to the festival, and bring the learning into the week. But at the same time, we're really keen to see more community focused workshops, more performances and participatory activity, particularly those happening across all of the different neighbourhoods in Birmingham. The grants programme that I'm going to speak about shortly is one of the key ways that we're supporting that, and inviting artists, organisations and communities to help shape what Healing Arts Birmingham really looks like on the ground. Okay, so that should hopefully give a sense of the kind of activity that's already taken shape during Healing Arts Birmingham. As I said, it's important to say that this programme is still growing, and a big part of our focus now is opening it up, making it easy for people to get involved, to connect their own activity into the week, and also to help shape what Healing Arts Birmingham looks like. There's three main ways that you can get involved. First is by visiting our website to find out more about the events during the week. And as the programme develops, there's going to be links added to sign up to those events. And we want as many people as possible to turn up to them. So please do get involved through that. The second way that you can get involved is you might already be planning an activity during that week or have something planned. So we want people to be able to register their events on the Healing Arts Birmingham website, to be associated with Healing Arts Birmingham and to kind of be promoted by it and benefit from it, to really have as much activity happening during the week as possible. And somebody can put the link to the chat for where you can register your own events. And finally, for anyone who would like to be supported to develop new work, particularly community focused workshops and performances, that's where our Healing Arts Birmingham Small Grants Programme comes in, and I'll discuss that in more detail now. So in terms of an overview of our Healing Arts Birmingham Grants Programme, these small grants are really about supporting the community to deliver creative health activity during the week and really building up that community focused side of the festival. So we're releasing a grants programme, and organisations can apply for between £500 and £1,000. We want that to be used for delivering things like workshops, performances, exhibitions, and for those to take place during Healing Arts Birmingham Week. And so in terms of what we're looking for this grants programme, any local arts, cultural, heritage and community organisations can apply. We're really keen to support locally rooted, accessible work. So particularly that's the sort of work that's serving underserved communities within the city and is representative of, but also really accessible to all of those communities as well. It should have a clear health and wellbeing focus alongside the creative health element. So in terms of how you can apply to get involved, all of the details for how to apply are on the website. So on both on the Birmingham City Council website, which somebody will put a link to, and on the Healing Arts Birmingham website. And information on applying for the grants will also be shared with all attendees, as well as distributed widely through different mailing lists and networks. We try to keep the process as straightforward and supportive as possible, but please do get in touch with our Creative Health Birmingham email if you've got any questions or if you have any support needs for being able to apply to this. So to summarise the Small Grants Programme, one of the main ways that we're supporting community-focused creative health activity. The grants are small and accessible. They're aimed towards artists and community organisations and community groups that work locally, and are designed to support workshops, performances and participatory projects. And you can find out all of the details on the website or by getting in contact via our email. So that brings us to the end of the presentation, and we'd really welcome any questions at this point. We've got about half an hour to have a Q&A. So whether it's about the programme, how you can get involved in Healing Arts or the small grants, we're happy to answer any questions. And if you have any questions that come up later, you can also find out more information on our website or get in contact, and we'd be happy to answer anything. Thank you, everyone. So I think the best way to do this is if we go through the Q&A feature and then also look through some of the questions in the chat. But then if anybody would prefer just to ask a question, we can, if you raise your hand, we can unmute you and you can ask your question yourself. So Emily, do you want to talk through some of the questions in the Q&A?
Yes. So Rebecca asks, do you need to be a certain type of organization like a CIC?
For the grants program, all of the eligibility criteria is outlined in the application document. So there are some requirements around being a sort of a constituted organisation that are just requirements from a Birmingham City Council level. But it's important to say that if you aren't an established organisation or you're a freelance artist, it doesn't entirely exclude you from the grants program, and we'd encourage people to reach out to their own local community organisations and put in joint bids, because we're open to consortium bids, people working together. And again, if you want to reach out to us via email to talk about that eligibility criteria and what the best way for you to get involved might be, then we're happy for people to do that.
Perfect, thank you. Somebody asks, could the grant program support or seed fund something like a mentoring program connecting artists to each other's practice and then share the outcome of this?
So I think for that that sounds like a great project. It would just depend on when it was happening. We're mainly looking for this funding to go towards projects taking place during the week. So if it was to run an activity, a workshop, or something that was sharing the details of that program during the week, then yes, absolutely. I think put an application in or email us and we'd be happy to discuss the specifics of that further. I think that answered the question. I can't see them written down, so
yeah, I think that makes sense. Liz asks, how are you going to promote activities taking place at the weekend? Is there a risk that by promoting the dates as the 22nd to the 26th, the weekend activities will get lost?
Yeah, that's a great question. So I think whilst I put it down as the 22nd to the 26th, we are exploring the options of extending it into the weekend. So maybe it makes more sense to think of it as the 22nd to the 28th. The reason it's 22nd to the 26th is that the kind of research panel policy discussions are all taking place within those 5 days. But we understand that, particularly given that it's taking place during term time, that might limit the accessibility of some of the events. So we are really keen for particularly the community focused activities to take place in the evenings, on the weekend, that sort of thing. So yeah, now that the grants program is officially launched, we might look to advertise it more as the whole week. Does that answer both parts of that question?
Yeah, I think it does answer that. Sam asks, could it be possible with an organization based in Coventry that includes artists in Birmingham in terms of the locality requirement?
Yeah, good question. I think it would be something that we'd have to discuss. The grant is for funding creative health work taking place in Birmingham and groups that are Birmingham based. If you could make the case that it was a Coventry organisation, but you're running groups with artists and particularly with Birmingham's communities, then it's a possibility. If it was just going to a Coventry organisation but wasn't working with Birmingham communities, then unfortunately not, because that's not the priority of the programme.
All right, thank you. Somebody asks, are there evaluation requirements and can evaluation support be offered to organizations at no cost?
Yes. So in terms of how we want to evaluate healing arts, there's a survey that's been developed alongside Jameel Arts and Health Lab that will roll out throughout the week, that should take place at all of the events. That'll ask questions to participants about kind of the impact on them, those sorts of questions. But we're also, in the interest of really promoting creative health, keen to showcase creative evaluation methods during the week. So as part of the grants program, we're encouraging applicants to evaluate their activities in creative ways. So that could be things like photos, post-it note walls that participants can fill in, artistic responses to the activities like poetry, and if you look within the grant application document, it does give some guidance as to what sort of creative evaluation we're looking for, and that is one of the questions in the application form. In terms of support for it, yeah, absolutely. We're here to give guidance on how people might evaluate their projects, and that would be free of charge. If you get in contact with the email, we're happy to set up calls to discuss that. We're also looking to put out some creative evaluation guidance in the coming weeks that will go to applicants and anybody else. I hope that answers that question.
Yes, thank you. Somebody asked, have all the events currently on the website been programmed in terms of themes, speakers, etc.? If not, how could we get involved in those? Also, when will booking be open, and do you have any idea of the cost to attend?
Okay, so it's a bit of a mix. Some of the activities are programmed, the dates are set in stone, the venues are set in stone, and the speakers are all sorted. Some of them we're still in the process of developing it and finalising it. Reese and Catherine, maybe it's best for you to come in on when people will be able to register.
Yeah, I can come in here. There's a mix, I think, for the registration of events. Some organisations are hosting them themselves, Ros, and some are collaborative between the lab and BCC Public Health. So I think if you drop creativehealth@birmingham.gov.uk an email, and then we can maybe discuss further about where you can maybe be in attendance or support as well.
What was the final part of that question? Sorry, Emily.
Yeah, the final part was when booking will be open, and if you have any idea of the cost to attend, which I think Reese kind of answered a bit there.
Okay, cool. Yeah, so some of the events will be free to attend, some might be ticketed, but all of the details for that will be on the website. And in terms of how you can get involved, some of them are conferences and panels, so where we are still looking for speakers. So yeah, get in contact over email.
Perfect, thank you. Lizzie asks, I run wellbeing yoga and art workshops. Would this apply? I'm guessing yes, that would apply, right?
Say that again, sorry.
So Lizzie asks, I run wellbeing yoga and art shops. Would this apply? Which that sounds like something.
Yeah, definitely.
Good. And then Alex asks, as a community center, we have a number of arts and crafts groups that we run throughout the week. Would a funding application be considered if we do a showcase exhibition of all arts and crafts groups?
Definitely, that sounds great. So in that instance, it could be that if you're already running workshops on a recurring basis, we could help advertise that through the website. But if you wanted to do a specific event that showcased the community activities that you do, like you say, an exhibition, that would be ideal, exactly the sort of thing that we're looking for. Yeah.
Awesome, thank you. Sorry. Looks like Sarah has her hand up.
Yeah, so I'll just unmute you now, or enable your mic. 1 sec. So your mic should be enabled if you now unmute. You should be able to speak. Sarah or Sarah, are you able to speak? I think you're unmuted now, so if you want to ask your question. If not, happy for you to type it in the chat. Okay, thank you. Then Kirsty, I will allow your mic. Yeah, so if you unmute, you should be able to ask your question.
Hi, can you hear me okay?
Yeah, we can hear you. You're right.
Thank you. I know that you mentioned earlier that you're keen for the grants, especially in the project, to support projects that are going to sort of become long-term investments. I'm really conscious that there's an awful lot of creative health stuff already going on locally that's unfunded. So lots of brilliant creative people and community organisations are doing lots of work like this already unfunded. And for those people, they might already have events, timetables already planned out for the year and schedules that they've had to get up front. That means that they'll sort of be ruled out because they won't fit into that one specific week. And then with having it be just, I understand that you have it, you know, it's unavoidable, but I'm just wondering if you've got any advice as to how to, you know, a small grant is likely to be able to fund an event that happens in that short space of time, but then there's a risk that it might generate an idea that then is left unfunded going forward. And I just wondered if you've got any advice how to sort of bridge that gap between, you know, if it's not going to be something that can fund things that are already happening and already scheduled outside that timeline, what kind of examples you think might fit that also aren't going to leave you potentially with an idea that then goes on to be unfunded.
Okay, so just to make sure I understand, your question is that there'll be lots of organizations that already have activities planned throughout the year, but that it might not be scheduled during the Healing Arts Week. So, but a lot of it might be unfunded. So what advice would I give to organizations? Is the question advice on how they should get involved in Healing Arts Week, or is it more a question of what to do after it?
Yeah, sorry, it's a bit of a tough one. I can't quite get my head around it, but I'm just coming from the perspective that, like, okay, this would be a great opportunity for things that are already happening that, you know, as we know, consistently struggle to get funding and have lots of people doing stuff for free. How do you, like, would you encourage people like that to try and, you know, put on an extra event just so that they can meet the criteria and fit into the week? Or would you encourage it more to be something that's a brand new idea, but that only has a very short term, you know?
Yes, okay, that makes sense. So both or either. If you have an existing project, existing group that you already have funding for, and this funding could be used to put on an additional activity, an additional performance that's an extension of that project and is a way to showcase it. But equally, if you have an idea for a new project that is unfunded, it could be an opportunity to run something during that week. It might be, for example, like a bit of a pilot, or a sort of a way to show what it could look like. I understand that the concern there is that it would have this bit of funding, but they might not then be able to secure further funding. So it's just a one-off thing that happens. I think, as I said earlier, we want Healing Arts to be not just about the week, but what happens after. And I think within the context of the wider creative health program, we're doing other bits of work like setting up an arts and health network that is for arts organizations and arts and health practitioners to come together, offer support to each other. So it's that sort of investment in the infrastructure and the collaboration that we hope will support local artists that might want to set up new activities on the best sort of routes to go. To be honest, we've got quite limited funding from the Creative Health Programme at BCC to fund activities, which is partly why we're looking to go more down that infrastructure route. But I wouldn't rule out that we fund activities going forward beyond Healing Arts as well. I hope that answers your question. I can't, yeah.
Thank you.
Okay, thank you. Katrina? You should be able to unmute.
Oh, is that okay? Can you hear me?
Yeah, I can hear you.
Hi. I just had a question. So I am a freelance creative designer. I'm based in Solihull. And I was wondering, a lot of my experiences in creating spaces for brands, so whether that's retail, pop-up, immersive experiences, all that kind of stuff. And I'd love to do something for this week. I think it would be a great way to transfer my skills into something really positive. But I don't know how if that's possible. Like, do I need to partner with an organization? If so, like how do I do that? How do I find the right people? Or can I just do it myself? I am set up as a limited company. Like, can I do that? I guess I just wanted to know with the ideas that I have around potentially some sort of installation or a space or something that could connect people. How would I go about doing that?
So in terms of the eligibility criteria and what sort of organisation you are, that's outlined in more detail in the application form. So I think that would be the first place to look. In terms of, so you could work with another organisation, like a sort of local community organisation as well, and put in a joint bid. In terms of support for identifying what sort of community organisation you might reach out to, if you want to email us, I'm happy to have more of a discussion and put you in contact with people that might be interested.
Okay, that's
that
great.
Would help.
Yeah, great. I've jotted down your email address, so yeah, that's brilliant. Thank you.
Thank you. Emily, where were we up to on the Q&A?
Yes, so we have a question from Sam, or more of a concern, I suppose. That he said, I think the question, sorry, I got scrolled down. I think the question is about how can we maintain activation generated from this event, which is also his concern, kind of maintaining that momentum beyond the week.
Yeah, great question. So my thoughts on that are that, so this is part of a wider creative health program that we've got for BCC, public health. So it's by no means the only thing that we're doing. The plan is going forwards to, as I say, set up that infrastructure, set up different networks that will really support creative health in Birmingham. In terms of the event itself, we've got the website and we want to have a really, part of the comms plan isn't just leading up to Healing Arts, but I guess is also after it as well. We hope that the relationships built during the week by people attending events is kind of what creates that momentum and allows that activation to go forwards. Catherine or Reese, I know that you've run Healing Arts events before, so I wondered if you could speak on that.
Sorry, Reese, do you want me to go ahead? Alex, could you just repeat the question?
Emily, do you want to say the question just so I don't misrepresent it?
Yeah, absolutely. So Sam mentions that his concern is, let me scroll back up to it, is about how we can maintain activation generated from this event beyond the week.
Well, I guess that's what the roundtables are about, and having some discrete conversations. I think it goes beyond Birmingham and across England, really, is how we're looking at systemic change in terms of embedding some of this work within the NHS 10-year plan, and also thinking about, the local objectives for Birmingham. So I guess there's several levels that we will want to kind of develop a legacy. One will be the impact report, which will come out evaluating the impact of the week and the kind of analysing the kind of priorities for everyone involved from grassroots right the way up. And then the other way is thinking about building the network and the legacy that kind of empowered network has, having worked together to create this week. thinking together about a task force and what the next steps are. And then there's a broader kind of national UK-wide picture emerging here about how we demonstrate to public health leadership and also ministers across health and culture about the value of this work and investment potential for the future for communities and hospitals, etc. Hope that was helpful.
Yeah, very helpful. Thank you. And Jasmine also added in the chat that we at Birmingham Creative Health are looking to develop a framework, and this type of sustainable model will be a fundamental component within the framework. Just had that. Other than that, Sarah said in the chat about the wonderful work that she's been doing in Bordsley Green and Small Heath, and says that she will reach out to us about these small grants. But other than that, I don't believe we have any other questions unless someone would like to add one before the meeting ends.
Hi, may I just ask another quick question? It was just, I'm not sure if you covered this right at the beginning, but is there a function or a place where people who are interested in applying can share ideas or information or resources with other people interested and make those links in like an efficient, open way in the run up to the application? Is there somewhere that we can do that? Because my experience has been in the past that it's quite like a secretive process, and that doesn't always lead to the best outcomes. But if there's some sort of way, you know, like to say, well, this is what we do, these are the resources that we have, you know, this is who we're looking to link up with. Is there some way to do that between creatives and organizations?
So yeah, it's a great idea. There isn't currently a sort of forum specifically for these grants, but I mean, there's been lots of people that have attended today, so I wonder if that could be an idea that's put in the chat, and if anybody would like to support each other. I think it's a great idea. I think I'll have to go away and explore how DCC and Jameel might be able to set something like that up, because I don't know off the top of my head what that might look like. But yeah, I think that's definitely a good idea. Jasmine, you've got your hand up.
Perhaps after the meeting, what we could do, my camera's not working. Perhaps after the meeting, what we could do is we could circulate an email around to everybody and see if anyone's interested in part of that conversation, and then maybe set up a kind of subgroup to link people
Definitely.
in.
That sounds good.
That sounds great. Thank you.
All right, just one more question from Vicky. Will the recording automatically be emailed out?
No, so I think the plan for the recording is that we're going to get it uploaded onto YouTube, and then all of the attendees and also just people that registered for the webinar, we will send out the recording, the link to the YouTube. I hope that answers that question.
Yes, that answers that. Let me just make sure there's no more. So Liz Perry asks, could you run another session for people looking for partners?
Yeah, we could look to do that. I'm conscious that the deadline is 7th of May, so it is quite a tight turnaround. But I think off the back of what Kirsty said as well, there's interest from people in a sort of forum or a session where people can discuss how they might partner upon it. So we can go away and look at how we set that up in the best way for everyone.
That's great. Thank you so much. That's all the questions that we have. So
that's great. Thanks, Emily. I think we can end there then. So thanks everyone for coming along to this webinar, and I hope it's giving useful information on Healing Arts Birmingham, how you can get involved, and how you can apply to our Healing Arts Birmingham Small Grants Programme. And I hope it's also got everybody kind of excited about Healing Arts Birmingham and